Hey everyone, wanted to come on today and talk about genetics, genetic testing, when it's necessary. Most people get recommended for it. I am Jenny Daniel, nurse with My Nurse at Home. I am the owner and CEO of the company and like to talk to everybody today about the genetic piece of breast cancer. So many people get recommended for genetic testing today. It's not like it used to be. Going back to the late 1990s and early 2000, I was talking to a patient yesterday about getting testing and when it's necessary, why you would, should you, all that kind of stuff. And I was explaining to her that I had cervical cancer, and I had a hysterectomy, but I come from a family with a very strong history of breast cancer. So that being said, when I was young, because my mom died when I was 12 from breast cancer, metastatic breast cancer, I was told always, when you grow up, after you have your babies, you'll have a prophylactic mastectomy, and therefore your risk will be decreased, because genetically they just assumed that I would get breast cancer just like my mom. So lo and behold, fast forward 1999, I was diagnosed with cervical cancer. In 2000, had one of my follow-ups with my gynecologist, oncology, GYN oncologist. Okay, there we go. And we were talking about things, and genetic testing was just kind of coming about. But at the time, in order for insurance to cover it, you had to actually see a therapist. Somebody had to actually kind of walk you through the process and like, what would you do with this information if you have this gene, kind of thing. So that being said, I went and I talked to this therapist, and they were like, okay, she's okay to get genetic testing. Like, I guess she knows what she's going to do, whatever. And I knew that, like, if I had the gene, I would probably have had the prophylactic mastectomies and just kind of dealt with that at the time, because I had already had a cancer diagnosis. So it was really different for me, even though cervical cancer is not supposedly genetic. And my cervical cancer was not HPV related. So there was a different little twist to that. Anyway, again, that being said, so went through my genetic testing. I did not at the time carry the BRCA gene. And at the time in 2000, there was only the BRCA mutation that they were looking for. We've advanced, so there are a lot of other mutations. So patients that look at genetic testing, if you are diagnosed with breast cancer, basically before 50, they're going to discuss genetic testing with you. If you are triple negative, they are going to discuss genetic testing with you. If you are male and have breast cancer, they are going to discuss genetic testing with you. If you have ovarian or fallopian tube cancer at any age, they are going to or should discuss genetic testing with you. If you have had breast, ovarian, pancreatic cancer at any age, and you are Ashkenazi Jewish ancestry, you should think about genetic testing. Ashkenazi Jews have a higher incidence of being BRCA positive, either one or two, the mutation one or two. Let's see, anything that where there's multiple individuals on the same side of the family. So like if your mother's side of the family, for instance, has multiple family members that are diagnosed with breast cancer, prostate cancer, pancreatic cancer, those kinds of things. If there's multiple individuals on the same side of the family, they should look at genetic testing. Okay, so there's a lot of different things, but the question comes down to like, so if you get this testing, what are you going to do with that information? Because that is a really kind of tough conversation to have with yourself. And only you can answer that truthfully. BRCA brings on a different level of information for all of us. And there are people that decide both ways, right? Because it's a very personal decision. So if you have the genetic mutation, meaning that you are BRCA1 or 2, if you have the mutation, or if you have any of the other mutations, because there's multiple other mutations, CHEK2, PTEN, CDH1, there's a whole bunch of other mutations that are in there as well that they've discovered. So if you have any of those mutations, they may possibly recommend that instead of just having a lumpectomy, you consider mastectomy. And of course, that brings on additional concerns, surgery, risk of infection. There's a lot of other things that go into that. But not only that, the emotional piece. You know, your breast is part of you. So how do you feel about that? Like, what are you going to do? Are you going to have reconstruction? Are you going to have a prosthesis? What are you going to do? But not only that, what do you do with this information? Because now genetically, if you have that mutation, you can pass that to a child, right? So there's a lot of pieces. And then emotionally, again, because a lot of the physicians in their offices, they don't address the emotional piece. Breast cancer in and of itself, the roller coaster of emotions, bloop, it's literally like being on a ride, because one day you're okay and the next day you're a mess, and then the next day you're just kind of like, this really sucks, and it sucks anyway, it sucks every day, but you're just like all over the map. One minute you're crying, the next minute you're laughing, the next minute you're really pissed off, really, really angry. I say to patients, it's kind of like going through the stages of grief, like you're grieving a loss, like death. So you just have to really take time and figure out for yourself what is the right decision, not just to have the genetic testing, but then if you get the information back, what do you do with that? Because so many people think like, oh, I'll just go get genetic testing. Okay, that's cool, but what are you going to do with the information once you have it? So important to think about that before you just get the information. If you already are comfortable having a mastectomy, okay, no matter what, you might be okay with having the genetic testing. But if you have the genetic testing and you have a mutation, you're also at a higher risk for ovarian cancer because they're linked. So then it's like, you got to think about down the road, especially if you're below 50 or if you're right around 50. Am I going to go through another surgery and have my ovaries removed now because that leads to other hormonal changes, leads to weight gain? You're already going to have some of those side effects from some of the medications that you're taking, and chemos, if you're on chemo, just from dealing with the breast cancer. So there's an added layer that, again, a lot of people don't get addressed when they're in the physician office making these decisions, because these are things that they don't walk you through, like in so many of the offices. So again, I say this just to be aware, because it's the emotional piece. And this is the frustration that I get from working in the big corporations and the big healthcare systems that we miss. That's where there's such a huge gap. That we have these patients make decisions kind of like on the fly, and we haven't walked them through what these decisions mean, what it comes down the road. I'm one of those patients. I had my ovaries removed. I went in to have one removed. I came out with both removed. And let me tell you, it's not a picnic. It took me years to adjust. I had mine removed in 2013. I had my initial partial hysterectomy in 1999. So 13 years later, and I can tell you personally, after being on estrogen, which I was also told I shouldn't be on because I'm a high-risk patient for breast cancer. I, again, come from that lineage of lovingly, everyone in the world in my family has breast cancer or the gene. Not me. I got the lucky straw, I guess. I got cervical cancer instead. Yay. I don't know which one's better. Like to have none. But it's again, these emotions that we deal with because they don't talk to us about the emotional piece and what we do with this and how we deal with these things. Dealing with the weight gain, dealing with the mood swings, the hot flashes. Oh my God, the hot flashes, they suck. And then dealing with everything else that happens to our body. Our body is not like what we've known our whole life. your whole body changes. So all of these things that you've had to like figure out, or you have to figure out, excuse me, as you go through. But again, let's go back, circle back. I know I can get on a tangent. We'll go back to, let me get a drink, my throat's crazy. We go back to the genetic testing and why we want to do it, right? Super, super personal. Just think it through. Don't do the genetic testing just because your doctor advises it. What are you going to do with that information once you have it? It's super, super important to think that fully through and know what that means to you and your family, because it does impact your family. But personally, in your heart, what are you going to do with this information when you have it? Can you handle that? Can you walk around the rest of your life knowing that potentially you have a genetic mutation? What will it do for you? Will it freak you out? Because the other piece of it is, if you choose to not have a mastectomy, bilateral mastectomies, if you have the mutation, and that's okay too, right? I'm a high-risk patient. I have my natural breasts forever, for the longest time, and still now. I see someone twice a year. I see a breast surgeon and I see my regular GYN, and I get exams twice a year. The recommendation, if you are a high-risk patient, gene carrier, or high-risk patient, right, coming from a lineage where there's lots of breast cancer, you have a physical exam by a provider like your breast surgeon, and then you have an MRI 6 months later. So you have a mammogram where you're followed up then by your surgeon, and then you have an MRI 6 months later. And that's how they track, because an MRI can pick up breast cancer earlier than our mammograms. But the key is also to know that even if you're a carrier, as long as you're diligent about getting your mammograms, your MRIs, they do ultrasounds on the breast now as well as part of a screening process if you're a high-risk patient. So if you're diligent about getting those exams, if you're a patient that doesn't choose to have bilateral mastectomies because you couldn't handle that emotional piece, just be diligent, be aware, do your own self-exams. I can't tell you how many people I've met that like caught their own breast cancer because they're like, oh my God, there's like a little knot. That wasn't there, last week. It takes like 1 billion cells to form a 1 centimeter, and a centimeter's tiny, look it up, I know it's tiny. It takes 1 billion cells, 1 billion cancerous cells to form a 1 centimeter mass in the breast. That's a lot. It doesn't come overnight. It seems like it comes overnight, but it doesn't. So just kind of keep that in mind too. If you're a really good patient and really good advocate for yourself, you'll catch this before it's somewhere else, most likely. Not always, most likely. But there's a risk if you're a BRCA, patient, and really anyone, you can get a breast cancer somewhere else in the body. You can end up with it in your liver, your lungs, your bones, and sometimes they find that. It's rare. I'm just throwing it out there. It's really rare, but it can happen. I don't want anyone to think like I'm just saying like if you don't have a mastectomy, you're never going to get a cancer, because that's not true either. These are just things like I like people to know what they need to think about. Okay, I want you to be aware. I want you to be an educated patient, and I want you to advocate for yourself and ask questions. That's the biggest thing that I can really convey to patients when they encounter the healthcare system. Because for most patients, you walk in and you're like literally a deer in headlights, because all this information is coming at you from a million directions. And with breast cancer, it's like you go in for your mammogram and then they're like, oh, I see a spot, you need to come back. You're in for a biopsy. Everything is happening so fast and you're so scared. Totally natural, totally understandable, right? But things are just being thrown at you. And then they're like calling you and they're like, okay, and I hate that. The phone call to tell you have cancer, how impersonal and rude. Absolutely hate that. Anyway, so you get the call, right? And then they're like just setting you up with some random breast surgeon. And the next thing you know, you're in someone's office who you don't know, scared to death, and you're sitting there in somebody's office and they're like, okay, so you have cancer and this is your image and this is where it is and this is what we're going to do. And they're either telling you you're going to a medical oncologist because you need chemo, or they're going to take you to surgery. You met this person for like 20 minutes and you're supposed to make up your mind like, okay, yeah, cut me. Yeah. Like, that's scary. It's really scary. You need to know what questions to ask when you go in there, okay? And half the time, that surgeon wants to do other tests or other exams, like they're sending you for further imaging or genetic testing before they're taking you to the OR. So like you're just literally in this state of like, oh my God, I just have to do all these things. I don't even have time to figure this out. They're just telling me I have to do it. And they make it sound so urgent, but you know what? It's not. It's not. Yes, it's important to take care of it. I'm not saying take like 6 years to make up your mind of what you want to do, but literally you have a few weeks to figure it out. And if you don't like that surgeon that they just paired you with, go find another one. Go get another one. Ask for a second opinion or call someone and be like, hey, can you help me find another one? Call me. I'll help you find another one. I don't care what state you're in. I'll help you find another one. I want you to find someone you're comfortable with. If you're having surgery, listen, find someone you're cozy with. That's like super personal. Okay? Just things to ponder. I just want you to be able to advocate for yourself. Understand what you're getting into, understand the information you're being given. Everything is personal. Everything that you're going through, it's personal. Okay? So take time, understand the information, ask questions, know what questions to ask. If you need help, I'm here. I'm happy to help. Always, always, always a free consultation. Okay? I always say it's 15 minutes. It's never 15 minutes because as you see, I talk a lot. So please reach out if you need help. I'm happy to do so. It is truly my passion to get patients to understand how important it is to advocate for themselves. Okay? I truly want you to understand the importance of this because without advocating for yourself, I couldn't even tell you like what might happen. I know for me, that's how my cancer was found because I kept pushing my GYN. I kept saying something was wrong. And they kept telling me, nope, you're too young to have anything wrong. Lo and behold, when I was diagnosed and I got all of my records and left the practice that I was with, the practice that delivered 2 of my 3 children, let me tell you, for the 3 years that I complained, the 3 years showed every freaking pap smear showed the same thing. Suspected adenocarcinoma, and I'll be damned. Yep. So thanks to them, this girl had a hysterectomy at 27. Thanks. It's all right. Got my babies. I'm good. I'm alive. It's all good. Advocate for yourself. That's all I can tell you. If you have questions, let me know. I'm here to help. Genetics is scary. It's scary that we know like what's wrong with our bodies and where the defaults are because you can't change that. Your genetics is your genetics. You're stuck with it. Let me know again how I can help. mynurseathome.com. There's a button for a free consult. Go ahead and set yourself up. Happy to talk to you. Let me know too if you have any other questions about the genetics and we'll talk further. Thanks for tuning in today. It's been great. Take care.